So, what is Picturing Medicine? It's an app-based project. The app's name is Picturing MD, and it's available on the App Store, and it's also available on Android too. And if I just open the app, you can see, if I go to themes, that the app consists of 5 different sections: one on trauma, one on syndromes, one on signs and symptoms, one on differentials, and finally one on anatomy too. And the aim has been, if I just click on the differentials there, to produce diagrams that summarize packages of information that are relevant for doctors and healthcare professionals, especially those in training. And examples of the types of things. Here's a picture showing the different causes of swellings in the neck, and the picture can be labelled and it can be unlabelled, and of course you can zoom into the picture to see a bit more information about the different causes of a swelling in the neck. And I try to sort of group them. So here we've got solid swellings on one side and cystic swellings on the other, for example. And then there's more information. If you click on there, it takes you to more information through internet services on that specific topic in question. So we won't do that for now. But yeah, so essentially that's what the app is all about. There's the information coming up. And there are lots of different examples of different differentials. For example, here's one on hand swellings. Again, you can label or you can unlabel those. The causes of hypertension, for example, the causes of jaundice, again an unlabeled and a labeled image. This one divided into unconjugated bilirubin and conjugated, or prehepatic, hepatic and post-hepatic. Signs and symptoms, that covers sort of different conditions that can present, and an explanation of the typical patterns that we see. So with a pulmonary embolism, for example, what do you see? Obviously, typically sinus tachycardia, but other features too, potentially low blood pressure, raised JVP, shortness of breath, hemoptysis, pyrexia, dizziness, and so on. What's the pattern of disease with malaria, for example? What do we need to look for those patients? What do we need to look for to identify patients who've got hyperthyroidism? What's happening with these patients? Again, you can add the labels, you can look at the diagram unlabeled, consider what's going on and test yourself. Nail changes, problems with vision, double vision, tachycardia again, warm peripheries and intolerance of heat, for example. So that just gives you a flavour of the app. Also sections on anatomy, looking at various different things, bones of the skull, for example, again labelled and unlabelled, and so on. So that's a flavour of the app.